Sure. So I'm Nena Sallah. I'm working with WHO as a consultant for the UN Interagency Task Force in Alexi's line, and I'm leading the digital health business case in collaboration with colleagues from ITU. So so we're doing the digital health business case mainly to support action on NCDs and mental health. The overarching aim really is to generate evidence-based knowledge on digital health interventions, so provide access to a consolidated and verified pool of information on what interventions work, how they can benefit respective national health systems, what investments are required to achieve successful implementation and scale, and really provide best practices to support action on NCDs, mental health, improve universal health coverage, particularly for low and middle income countries. The second objective is to support the promotion and implementation of these digital health intervention programs that can be empowering and accessible for patients, more efficient for providers, and cost-effective for health systems. We also hope to develop economic modeling methodology modules for interventions, and these will serve as important instruments for decision-making and implementation. So these will be tested, cost-effective digital health solutions. So for the business case, we are analyzing what digital health interventions are currently being implemented and have proved their workability, so what works in different environments. We'll be analyzing some key enabling factors and cost effectiveness of implementing and scaling, how they impact health, what social and economic returns they provide, and what return on investments they will be providing. We'll be providing a set of case studies to support the report, which will highlight the experience of implementing various solutions. We hope that this can also be used as an advocacy piece to raise awareness and propose practical and innovative approaches to support governments, NGOs, and other stakeholders in their digital health transformation journeys. We have 3 deliverables for this case. So the first being a report, which I will break down a little bit further in the next slide. The second being the economic methodology for interventions modules, which can be used to support national investment cases, and then a training of health economists and digital health specialists. So breaking down the case components further, the business case itself will consist of stakeholder interviews and case studies, which will support evidence collection for the literature review, identifications of standards and requirements. And then alongside this, we will have economic and cost effectiveness analysis, which will form largely part of the economic module. And just going through the process over the next few months, we've been doing some desk research to identify relevant resources for the literature review, along with consultation and input from internal and external stakeholders, so internal being WHO and ITU largely, and other partners as well. We've been doing stakeholder consultations alongside this as well, external, speaking with public sector who are experienced with NCDs and mental health. We've been speaking with agencies that have rolled out digital health solutions. We've been speaking with persons of lived experience to have a patient-centric perspective to support this business case as well. We've shortlisted some interventions following a rapid literature review, and we've been gathering data for costs to support the economic modeling modules. So just briefly, following a rapid literature review initially and with expert consultations, we've narrowed down the digital health interventions that we will be covering for this business case into the following 5. So mostly targeted communication such as text messaging solutions, mobile applications, chatbots, telemedicine, and health information system. And this is largely based on the evidence that's out there, so peer-reviewed. Yeah. So just to touch on the progress to date, we hope the literature review will be completed by the end of the first quarter. So we've gone through literature search of over 800 sources for telemedicine. We've completed, we have a draft for diabetes, and other conditions are in progress. For text messaging, over 1,000 sources have been screened, and the project team has collated about 20 systematic reviews covering several different conditions. For chatbots, a literature search has also been completed, and a review is in progress, although the studies here are quite limited. Health information systems are also just kicking off, and we've shortlisted some publications looking at the impact of EMRs, medical records, and electronic health records in care. We've also been looking at mobile applications, and a search and screening criteria are being defined for this. As I mentioned, we are also doing the stakeholder interviews alongside this, and we use the expert consultations to update some of our strategies for the literature review as well, and also to fill in some of the missing gaps. We've interviewed over 30 stakeholders, and we have about maybe at least 5 more planned for the next month. And to just briefly speak on the economic methodology, this is just kicking off, and we hope it will be at least completed by the end of Q2. Generic cost components are currently being identified by the project team, with a validation process being designed in consultation with digital health specialists and economists. Markov models are currently being developed for each NCD area, and ROIs will be quantified to identify best buys and level of investment in programs. Some of the metrics we'll be using will be surrogate endpoints to compare standard care versus with intervention, and looking at restored productivity, cost comparisons for health information systems. As I mentioned, it's been quite challenging to get good data in peer-reviewed sources. You know, there's also a challenge of poor quality of some of the studies, and it's been difficult to disentangle some of the interventions and their impacts, as they're often pulled together. But we've been overcoming some of these limitations through our stakeholder consultations, who some of them have been kind to provide us some data on costs. So we hope that this will fill in some of the gaps that we're getting from the literature. And yeah, that's where we are. Thank you. I'll hand over to the next presenter, and then happy to discuss further.